Question 1. Which task should the RN delegate to a UAP? A. Ambulating a stable post-op client. B. Teaching post-op wound care. C. Assessing pain after medication. D. Inserting a Foley catheter. Answer. A. Ambulating a stable post-op client. Question 2. Which client should the nurse see first? A. Client with oxygen saturation of 88%. B. Client with nausea and vomiting. C. Client needing for antibiotic at 10 a.m. D. Client due for discharge teaching. Answer. A. Client with oxygen saturation of 88%. Question 3. Which task is appropriate for an LPN? A. Administering for push morphine. B. Assessing a new stroke patient. C. Monitoring a client with stable hypertension. D. Creating a care plan. Answer. C. Monitoring a client with stable hypertension. Question 4. A UAP reports a client fell. What should the nurse do first? A. Call the provider. B. Ask the UAP what happened. C. Assess the client for injury. D. Complete an incident report. Answer. C. Assess the client for injury. Question 5. Which client needs immediate attention? A. Diabetic client with foot tingling. B. Client with chest pain unrelieved by rest. C. Post-op client with 2 cm wound dehiscence. D. Client reporting constipation. Answer. B. Client with chest pain unrelieved by rest. Question 6. Which task can the nurse safely delegate to a UAP? A. Administering oral medications. B. Monitoring post-op bleeding. C. Assisting with hygiene care. D. Evaluating dietary compliance. Answer. C. Assisting with hygiene care. Question 7. What is the first action after a medication error? A. Notify the provider. B. Monitor the client. C. Complete an incident report. D. Inform the charge nurse. Answer. B. Monitor the client. Question 8. Which assignment is appropriate for the RN to give to the LPN? A. Developing a nursing diagnosis. B. Conducting initial assessment. C. Giving routine oral medications. D. Performing client education. Answer. C. Giving routine oral medications. Question 9. Which client should the nurse assess first? A. Client with a low-grade fever. B. Client with stridor and restlessness. C. Client requesting toileting. D. Client with mild nausea. Answer. B. Client with stridor and restlessness. Question 10. A nurse assigns a UAP to take vital signs. What requires follow-up? A. UAP documents without notifying abnormal BP. B. UAP asks for clarification on technique. C. UAP reports values as requested. D. UAP completes task on time. Answer. A. UAP documents without notifying abnormal BP. Question 11. Which action by the nurse demonstrates effective delegation? A. Giving 4 meds to a UAP. B. Asking UAP to monitor post-op pain. C. Delegating ambulation to UAP. D. Instructing UAP to perform suctioning. Answer. C. Delegating ambulation to UAP. Question 12. A client is confused and trying to get out of bed. What is the best action? A. Apply restraints. B. Call the provider. C. Assign UAP to stay with the client. D. Raise all side rails. Answer. C. Assign UAP to stay with the client. Question 13. The nurse finds a UAP using improper technique. What is the best response? A. Report to the nurse manager. B. Reassign the task. C. Provide immediate corrective instruction. D. Document the incident. Answer: C. Provide immediate corrective instruction. Question 14. Which task can the RN delegate to a trained LPN? A. Blood transfusion monitoring. B. Initial mental status exam. C. For antibiotic administration via central line. D. Reinforcement of teaching about diet. Answer: D. Reinforcement of teaching about diet. Question 15. A client becomes unresponsive. What should the nurse do first? A. Call the provider. B. Check for a pulse. C. Begin CPR. D. Alert the rapid response team. Answer: B. Check for a pulse. Question 16. Which action by the UAP would require nurse intervention? A. Elevating the client's legs while lying down. B. Reporting pain level to the nurse. C. Applying hot compress to a client's abdomen. D. Assisting with a sponge bath. Answer: C. Applying hot compress to a client's abdomen. Question 17. The RN must assign a client to an LPN. Which client is best? A. A client newly admitted with sepsis. B. A client with unstable angina. C. A client needing wound care for a stage 2 ulcer. D. A client needing blood transfusion. Answer: C. A client needing wound care for a stage 2 ulcer. Question 18. The RN notes the LPN is performing a skill incorrectly. What should the nurse do? A. Stop the procedure and provide correct guidance. B. Ignore it unless the client is harmed. C. Document the error only. D. Ask another nurse to supervise. Answer: A. Stop the procedure and provide correct guidance. Question 19. The nurse hears a UAP yelling at a confused client. What is the priority action? A. Document the incident. B. Notify the supervisor. C. Intervene immediately and remove the UAP. D. Talk to the UAP later. Answer: C. Intervene immediately and remove the UAP. Question 20. Which of these tasks should not be delegated? A. Vital signs on a stable client. B. Transporting a stable patient to X-ray. C. Instructing about medication side effects. D. Feeding a client with aspiration risk. Answer: C. Instructing about medication side effects. Question 21. A nurse is assigning tasks on a busy unit. Which task is most appropriate for the UAP? A. Feeding a client with dysphagia. B. Assisting a stable client to the bathroom. C. Administering a rectal suppository. D. Performing a sterile dressing change. Answer: B. Assisting a stable client to the bathroom. Question 22. Which patient assignment is appropriate for the LPN? A. A newly admitted client with heart failure. B. A client receiving for potassium chloride. C. A stable client requiring wound dressing changes. D. A client in diabetic ketoacidosis on insulin drip. Answer: C. A stable client requiring wound dressing changes. Question 23. The nurse delegates vital signs to a UAP. Which finding must be reported immediately? A. Pulse 92 BPM. B. Respiratory rate 22 per minute. C. BP 200/110 mmHg. D. Temperature 99.4 degrees Fahrenheit. Answer: C. BP 200/110 mmHg. Question 24. Which action reflects proper supervision after delegation? A. Assuming the task will be done correctly. B. Asking the UAP to report any issues. C. Delegating a complex sterile procedure. D. Following up to ensure task completion. Answer: D. Following up to ensure task completion. Question 25. A nurse observes a UAP positioning a client incorrectly. What is the best response? A. Correct the UAP immediately and explain why. B. Write up the UAP for a safety violation. C. Report the incident to the nurse manager. D. Reassign the UAP to a different unit. Answer. A. Correct the UAP immediately and explain why. Question 26. A client has a new colostomy. Which caregiver is appropriate to reinforce education? A. RN only. B. LPN. C. UAP. D. Charge nurse only. Answer. B. LPN. Question 27. Which task should the RN perform and not delegate? A. Assisting with ambulation. B. Emptying a Foley catheter bag. C. Performing a new admission assessment. D. Transporting a client to physical therapy. Answer. C. Performing a new admission assessment. Question 28. A client receiving opioids reports difficulty breathing. What is the nurse's priority? A. Call respiratory therapy. B. Administer naloxone. C. Apply oxygen. D. Check the oxygen saturation. Answer. B. Administer naloxone. Question 29. Which action is appropriate to delegate to a UAP during a code blue? A. Administer 4-epinephrine. B. Start chest compressions. C. Defibrillate the client. D. Interpret the cardiac rhythm. Answer. B. Start chest compressions. Question 30. The nurse is prioritizing care. Which client should be seen first? A. A client with uncontrolled hypertension. B. A client requesting pain medication. C. A client with sudden shortness of breath. D. A client with dressing due for change. Answer. C. A client with sudden shortness of breath. Question 31. A new LPN is assigned to care for a client with a chest tube. What should the RN do first? A. Ask the LPN to complete the assignment. B. Provide supervision and guidance. C. Delegate the task to a UAP instead. D. Assign the client to a more experienced nurse. Answer. B. Provide supervision and guidance. Question 32. The UAP tells the nurse a post-op client has not voided in 6 hours. What is the best action? A. Reassure the UAP it is normal. B. Ask the UAP to increase fluids. C. Assess the client immediately. D. Document the concern in the chart. Answer. C. Assess the client immediately. Question 33. Who should the nurse see first after receiving morning report? A. Client requesting medication for headache. B. Client complaining of new onset confusion. C. Client with stable vital signs and wound dressing due. D. Client who needs help with morning hygiene. Answer. B. Client complaining of new onset confusion. Question 34. Which action by a UAP requires intervention by the RN? A. Recording a client's food intake. B. Applying lotion to dry skin. C. Reporting a BP of 90/60ths mmHg. D. Giving ice chips to a NPO client. Answer. D. Giving ice chips to a NPO client. Question 35. What is the best indicator that a delegated task was performed correctly? A. The nurse assumes the UAP is competent. B. The client thanks the UAP. C. The nurse observes the completed task. D. The task was finished on time. Answer. C. The nurse observes the completed task. Question 36. Which client can the LPN safely care for? A. A client with a new tracheostomy. B. A client receiving for chemotherapy. C. A client 3 days post-op needing wound care. D. A client needing discharge teaching. Answer. C. A client 3 days post-op needing wound care. Question 37. A client complains of dizziness when standing. What is the nurse's first action? A. Call the provider. B. Recheck orthostatic vital signs. C. Increase fluid intake. D. Encourage ambulation. Answer: B. Recheck orthostatic vital signs. Question 38. What action by a nurse shows appropriate delegation to a UAP? A. Teaching a client how to use an incentive spirometer. B. Asking the UAP to assist with range of motion exercises. C. Instructing the UAP to assess breath sounds. D. Asking the UAP to perform blood glucose checks. Answer: B. Asking the UAP to assist with range of motion exercises. Question 39. Which task should not be assigned to the LPN? A. Monitoring a stable post-op client. B. Reinforcing discharge instructions. C. Initiating a care plan. D. Administering oral medications. Answer: C. Initiating a care plan. Question 40. A client with COPD is on 2 liters per minute oxygen. The UAP increases the flow to 6 liters per minute. What should the nurse do first? A. Instruct the UAP on oxygen safety. B. Turn off the oxygen. C. Assess the client's respiratory status. D. Notify the provider immediately. Answer: C. Assess the client's respiratory status. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.